Good morning. Welcome to everybody. And thank you for joining me. Thank you for taking the time to listen in on this presentation about something that I personally feel is very important. And that is how to personalize botanical medicine for various health conditions. And I just want to emphasize that this is not about how to use herbs specifically for specific health conditions. It's really about how do we use botanical medicine in general in a way that makes it more effective. And I'll just mention that this is a presentation that is an introduction to a new course that I am presenting, which is titled Principles of Clinical Level Self-Care. And so these are some of the terms that I'll be using in this presentation: clinical level self-care and becoming a self-care clinician. And what does this have to do with using herbs? So I'm going to start by just defining some of these terms and answering some of these simple questions, like what does personalizing botanical medicine actually mean? And why is it important? And most importantly, how do we do it? How do we personalize botanical medicine? So in Chinese medicine and Ayurveda, the classical Asian medical systems especially, the only medicine that has been available, that was available for centuries and centuries, was personalized botanical medicine. And distinct diseases were known, but in general, if you went to a doctor who was almost always primarily an herbalist, then you would receive certain herbs and formulas, and they would, of course, address a known condition. But it would always be given in the context of who you are, your age, your constitution, strength of your digestive system, and so forth. And so even though classical Asian medical systems and all other medical systems actually were treating known illnesses, they were primarily treating the individual with their individual manifestation and presentation of symptoms and signs. So in other words, it was not cookie cutter medicine. It was not one drug for everybody. It was treating the individual in a personalized way. Now, the main difference between modern medicine and classical Asian medicine is that allopathic medicine treats diseases, and classical medical systems like Chinese and Ayurvedic medicine treat individuals with unique presentations of illness. Now, modern medicine has some degree of personalizing medicine, but rarely, it's not a lot more than just adjusting dosages of medications based on your age and weight. Now, why is personalizing botanical medicine important? So if we look at cases where modern medicine, allopathic medicine, is really the best treatment, it doesn't really matter in a certain kind of way. And that's because what modern medicine does best really is acute care, emergency medicine. And if you go to the emergency room with something like an abscessing diverticulum, and say you get diverticulitis and it becomes severely inflamed and it turns into an abscess, then you'll go to the emergency room and they're going to put you on antibiotics and they're going to do what they have to do. And that's the treatment. And that's what it's really good for. And it isn't really going to take into consideration a lot of individual factors, and it doesn't need to. It may consider what medications you're on and so forth, but that's about the extent of it. So that's what allopathic medicine, modern medicine, does really well. And it doesn't really have to be personalized in a lot of ways. So this is the strength of allopathic medicine, and it's wonderful. But here's a fundamental problem. And this is really why we should understand how to personalize botanical medicine. And that is that modern medicine, allopathic medicine, pharmaceutical-based medicine, is being used to treat a huge number of conditions that it's really not best at treating. And these include chronic degenerative conditions and autoimmune conditions and post-viral and post-infectious conditions, neurodegenerative conditions, conditions coming from the toxicity of the world and stress and so forth, weakness of immunity, nutritional deficiencies, all these kinds of things that are widespread now. Modern medicine is not the best treatment. And of course, one of the main things that it cannot treat is what's called iatrogenic illness. And iatrogenic means diseases coming from doctors and drugs. And so we have epidemic levels of morbidity and fatalities coming from prescription drugs. And obviously we can't treat that with more prescription drugs. So a basic concept to understand is that all illness at some level has two fundamental roots. There's a toxic burden to the body, and there's a nutritional deficiency. Now, pharmaceutical drugs are wonderful for what they do, but you can read the entire 4,000 pages of tiny print in the physician's desk reference, and you can't find a single drug that gives nutrition, and you can't find a drug that detoxifies, you see. And so that's the weakness of pharmaceutical medicine. And it cannot improve our vitality, our resistance, and our immunity, which is crucial now. Now, in order to treat all these other kinds of conditions that have to do with toxicity and rejuvenation and have to do with all of the different factors that are affecting us now that are not emergency medicine, in order to treat those conditions that require nutrition to rebuild us and require detoxification to cleanse the system, we must treat the individual. You see, that's the crucial reason. And so to prevent that diverticulitis, you need a diet and an herbal program that is personalized for you. And if you are coming out of the emergency room, you're coming out of the hospital after a stay there because of this abscess diverticulitis, just one example, you are going to need a program that's going to help you to detoxify and rebuild. And that has to be done in a personalized kind of way. Now, the interest in natural medicine, we know, has been growing very rapidly. It's been growing rapidly for the last 20, 30 years, but this year it has really exploded because of the COVID pandemic. Now, a lot of what's available to people when they first go looking or they first encounter herbal medicine is through the internet. And much of what is on the internet is based on marketing. And because of that, a lot of what people first encounter when it comes to botanical medicine is not personalized. And if it's not personalized, it frequently does not work as well as it should, or sometimes it doesn't work at all. And I'll give you a couple of simple examples. A lot of men are, excuse me, a lot of men are looking for something to treat their enlarged prostate. And so saw palmetto is very famous, and it may be beneficial for some men, but this is not a personalized approach because BPH is caused by a multitude of different factors that have to do with things like metabolic syndrome and weight gain and high cholesterol and hormonal fluctuations and all these kinds of things. And so if we use a marketing-based symptomatic approach with a simple herb product like that, the likelihood of it working well is quite low, actually. So that's the importance of personalizing botanical medicine, because if we want botanical medicine to really work well, we have to use the right ingredients. Now, it could be that saw palmetto is part of a program for a man with an enlarged prostate, but if the underlying conditions are not diagnosed and addressed, then there's a very high likelihood that after some time, he's just going to come to the conclusion that herbs don't work. And that's not the case. Herbs work when they are done holistically in a personalized kind of way. Lots of other examples of this. As a matter of fact, I can say that almost all herbs in more complex cases need to be personalized, all right? And even things that are relatively simple, like taking turmeric, a lot of people find that it can be upsetting to the upper GI system, and it's contraindicated for people who have gallstones. You see, so we need to know these kinds of things to really apply herbal medicine well. Another really good example is herbs for sleep and for stress. And a lot of times they just don't work because you must understand the person, not just treat the symptoms. It's not a simple thing if you just take herbs and your mind feels miraculously better. Sometimes, but a lot of times it doesn't work. Now, I like to use Chinese medicine as an example of many things. And so what I'm going to mention here is that in general, where we're going right now with the integration of allopathic medicine, modern medicine, traditional, natural, botanical medicine is towards a synthesis of systems. And that's what this presentation and what my course is also about, is where is all of this going and how can we be up to date in using medicine in the best possible way. Both systems, okay, not just one or the other, both systems. So in the Chinese medical system, in modern Chinese medicine, what has happened is that they have taken, the Chinese government has taken the formulas and the herbs that have been used traditionally for centuries and centuries, and they have included it in their modern healthcare system. And they have identified what these herbs and formulas are best at doing. And they have also identified what allopathic medicine is best at doing. And they have also identified when it is best to use both together. And so in a lot of hospitals in China, you will meet with a team of doctors and they will basically say, all right, this is something for the acupuncturist, this is something for the herbalist, and this is something for the surgeon, you see. And so that's how we can start to imagine the best medical system. We use the best of both in a very individualized way, and that way we get the best results. Now, because we're a bit behind here in many ways in the United States, then we're going to have to do this ourselves. The government is not supporting natural medicine and not taking on these kind of projects like, oh, let's create the best healthcare system we can. Far from it. So we have to do it ourselves, and that's what this talk and this course is about. So I'll give you a little bit of good news and a little bit of bad news. Now, the good news is that in a lot of cases, herbs actually work better than drugs with less toxicity. But the bad news is that herbal medicine is, in a lot of cases, not a counterpart to allopathic medicine. We have to think very differently and use it very differently. And that's one of the main principles of personalizing botanical medicine. Don't think that turmeric is the counterpart to an anti-inflammatory. It isn't. Or don't think that CBD is the counterpart to an over-the-counter pain medication. Now, in some cases, there can be some parallels, but in most cases, we have to go more deeply into the relationship that we have with the plants and understand how they are working and understand what they're trying to tell us. And a lot of times that has to do with cleaning up our diet and improving our lifestyle and taking better care of ourselves. And that's part of being a self-care clinician, is understanding all of those kind of things. So it's a different way of thinking. It's a different way of living, really. Pharmaceutical medicine is for a certain kind of lifestyle. Natural medicine requires more participation, all right? And so that's a fundamental principle here. Now, a lot of people just want to know, what do I take for my condition? And that's why I'm mentioning it, because that's, again, a place where herbal medicine doesn't work very well if we're thinking like this. So we have to change our thinking in order to really get the best benefits out of natural medicine. So there's lots of examples of this. You know, a lot of the herbs that are used for antidepressant and anxiolytic kinds of purposes, for example, we actually have to work really deliberately and carefully on our side, diligently, to actually change the conditions inside our own consciousness. And the plants can help us do that, but we should not expect the plants to just come in and just lift us out of a bad mental state. Okay, we can use the plants to help us do it ourselves. So this is a principle that's important apply here when we are personalizing botanical medicine. A lot of herbs, you don't need to think like this, however. If you take peppermint tea, it's going to get rid of the gas in your intestines. You don't have to think in terms of how personalized is it. If you take some demulcent herbs like some slippery elm or some licorice root, it'll soothe your upper GI system. It doesn't matter who you are. So there are a lot of herbs that can be used symptomatically, but what we're really talking about here for personalizing is when things need to be addressed at a deeper level. All right. So now we've defined, I have told you what personalizing botanical medicine means and why it's important. And now I'll jump into the main part of this presentation, and that is, how do we do it? And there are 5 main points that I want to cover. And the first one is, we must develop some self-diagnostic skills, okay? And especially when we're confused because we have mixed information from different practitioners. And this happens fairly frequently, actually. If we are seeing a number of different natural practitioners, it's often the case that we'll get information that one practitioner looks at it like this, another practitioner looks at it like this, and this practitioner will say, well, you have this, and this one says, well, you have that. And then the doctor might even say, well, you don't have anything, but you know that something is going on. So how do we deal with this? And this principle is fundamental to personalizing botanical medicine, all right, is knowing basic self-diagnosis and self-care diagnostic skills. So let's just address this a little bit. And here's a kind of a general philosophical view about it, okay? Knowing our diagnosis, knowing self-care diagnosis is actually a kind of spiritual practice, because what we're talking about is personal exploration. We're getting to know ourselves better. So what we're talking about is knowing ourselves, but we're looking at ourselves through a medical lens, and we're starting to understand a step at a time how the body works. Now, I think it's fairly accurate to say that all of us here have some degree of knowledge about how our body works, but most likely all of us have a long ways to go to really understand what the body is doing and why, and the sensations that it's producing and why, and what to do about them. You see, so if we are going to learn to take care of ourselves at a higher level, okay, clinical level self-care, then we're going to have to learn more about our body. And if we know more about our body, we know more about our mind, and we know more about who we are, really. And so there's a spiritual dimension to actually knowing ourselves medically. It's self-awareness, it's self-knowledge, all right? We also have a lot of diagnostic tools that are available to us. And the main one that's available just through our own self-awareness is the body itself. The body's always telling us information. We just need to learn how to pay attention to it very carefully and understand what it's telling us, you see. And then we have all kinds of other resources we can use. And a lot of times we do not need to pay doctors and go to clinics. We can order things online. We can order tests online, and we can also do research, and we can find out a lot of different things and basically become our own diagnostician. But let's answer a few basic questions here. What am I talking about when I say self-care? And what am I talking about self-care diagnostic skills? And what am I talking about clinical level self-care diagnostic skills? So first of all, self-care. We all know what self-care is, but the more we understand the term and the more we are clear about what we're doing, the more deliberately we can approach it. And so our diet and sleep and exercise and mental habits and emotional habits and self-nourishing routines, all these things are self-care. And then what is self-care diagnostic skills? What does that mean? It means the ability to monitor our self-care routines and adjust them as needed. And so people have a good sense of what self-care is, but how many people really turn self-care into an ongoing process that's leading in a specific direction towards better health? So we need to know, does the food agree with us or not, and why? And that helps us to create a personalized dietary program. Can you tolerate indulgences or not, or how much? Are you getting enough or not enough sleep? Are you managing and monitoring your stress levels? These are ongoing self-care diagnostic methods. And one of the most important ongoing objectives of natural medicine is to help us become more aware of these processes happening inside of us. So back in the days when you could see a natural practitioner and receive a combination of massage and some acupuncture, or get some chiropractic and a massage, or get Shirodara, the Ayurvedic warm oil treatment over the head, most of the benefits would come because it would put you into a deeply relaxed state. And in that deeply relaxed state, you would be able to learn more about, this is what health feels like, this is where I contract, this is what I do about it, this is where I lose contact with the sense of well-being, this is how I restore it. So that is doing self-care diagnosis on ourselves. All right. So that's the primary goal of most natural treatments, is to enhance our self-awareness. Now, what does clinical level self-care mean? I'm going to take this up to the next level here. And it just means that we know more about self-knowledge and self-awareness, and we can learn this ourselves without paying somebody else to tell us. All right. So the clinical level is, well, let's use digestion, for example. What is self-care diagnosis at a clinical level for our digestive system? All right, this is very, very common. And so these principles apply to practically everybody at some time of life. All right. So if you have digestive problems, you need to become knowledgeable about how your digestive system works. All right. And it's not that you have to become an expert in the anatomy and physiology of the digestive system. You just have to know some basic important principles. You have to know why your digestive system is doing what it's doing. And that means that you have to understand a few things about motility. There's a biorhythm. It moves in a certain way in a 24-hour cycle. You have these secretions that have to happen in the upper GI. You have this elimination that has to happen in the lower. There's fermentation, there's inflammation. These are basic, simple principles that apply to everybody. And the more we understand them, the more we're able to practice clinical level self-care and clinical level diagnosis on ourselves. So in order to understand the digestive system at that level further, we should know something about inflammation. We should know about the healthy diet. And I'll leave you with this point, okay, in this talk, and that is that we don't need to know a lot of herbal medicine, actually, to be very effective in treating a lot of conditions. So there are three primary categories of herbs that work on the digestive tract. And those are bitters that stimulate the secretions in the upper part of the digestive tract. And there are the demulcents that are soothing to the mucous membranes. And then there are the aromatics that get rid of the gas and the bloating, you see. And you can actually do self-care diagnosis, clinical level self-care diagnosis yourself by just taking one of those herbs at a specific time of day and seeing what it does. So we can completely diagnose our digestive tract using only 3 herbs at the right time. See, so that's what I'm defining here, clinical level self-care, like that. And another example, sleep. Most people don't need a natural practitioner or a psychiatrist or a doctor at all to tell them that they need better quality sleep. But what people need to understand, and this is where clinical level diagnosis comes in, is why are people not getting good sleep? And that's where you can't really get the best results just saying, oh, I should take valerian, all right? Because there's so many reasons that sleep is disturbed. The influence of the mind and the emotions and the diet and the digestive cycle and the blood sugar and the hormones and inflammation and medication, so many different kinds of things, all right? So the more we understand about what's influencing all of those different aspects of ourselves through self-awareness, self-diagnosis, the better the results are going to be. All right, so let me wrap up this one section by just answering this basic question. What are you going to do if a number of different practitioners tell you, you have this or you have that, or the doctor says nothing is wrong, all right? A lot of times with the kind of chronic degenerative sort of, emerging conditions based on a lot of factors, toxicity and stress and all these kind of things. A lot of times there's not much to find physically in the allopathic system, even though people can feel really badly. Part of it is that it is not manifesting in a way that can be diagnosed yet, okay? But here's a real important principle to consider, and that is that especially in natural medicine, to a hammer, everything looks like a nail, all right? So what does that mean? It means that practitioners see what they specialize in, all right? And this is something to keep in mind when somebody tells you, you have this condition. Like, for example, this is closely linked to trendy diagnoses also, like SIBO, small intestine bacterial overgrowth, is very trendy. Now, there's some truth to it, okay, but practitioners will go and they'll take a workshop and they'll learn about it. And then suddenly it looks like everybody's got SIBO, you see, or suddenly everybody's got heavy metal toxins and these kind of things. So keep in mind that that is a factor in how this problem is created. And that also happens with allopathic medicine as well. There's trends in allopathic medicine. And we just need to be aware that if we're thinking like that, we're not seeing the individual. You see, we have to see the individual, not the trendy diagnosis. So one of the things that's happening that's really good is that there's so much research coming out now about the interrelationships of how things work in the body. And I imagine that most or all of you have heard this term gut-brain axis. All right, well, that's an example of how different parts of the body work together that weren't even recognized maybe even 10 years ago, so much in modern medicine. But in Chinese and Ayurvedic medicine, gut-brain axis is not new at all. It's been talked about for centuries and centuries. And now what we're having is an evolution, a very positive development, because more of these interrelated systems are coming out in modern terminology. So gut-brain axis was diagnosed as spleen qi deficiency, okay, or possibly stomach fire in Chinese medicine. But now we're also seeing the physiological mechanisms elaborated in modern medicine. So we also have like the HPA axis, okay, the hypothalamic pituitary adrenal axis, which is what the adaptogenic herbs address. We have the gut and lung axis, okay, that would be spleen and lung qi in Chinese medicine. We have pancreas and adrenal axis. All of these things now are giving us new language. And this new language is something that all of us here can learn. It's very basic. The principles are important, okay? But what does it mean in terms of practical application? If you're sensitive to gluten and you eat some bread and you get brain fog from it, then that's gut-brain axis. That's self-care diagnosis. And you can learn to do that at a clinical level. Okay, so there's a few things that are important. I'll just wrap this up with a list here. To really develop self-care diagnosis, what do we need? We need a detailed health history. It's really important. Doctors are always overlooking major events in life that are relevant to what's happening now. And we also need to understand that symptoms frequently happen in a part of the body that affect everything else. Like, for example, autoimmune conditions, they don't just happen because of nothing, because of one cause. Autoimmune conditions can have 10, 15 major causes all coming together, you see. So we have to really look at a person's history, and we have to take into account, well, what happened with the vaccines, and what happened with the mercury in the mouth, and what happened with the viral infection, or what happened when you got sick when you went to Asia and your intestines and all of that. These things all add up. They build up over time, and then they become complex and chronic and more difficult to treat. So we need to really understand the multifactorial issues, and that gives us good information. How did it develop? And what is it? And what's the best thing to treat? That's a major thing that is confusing for people, is that when there's several things going on, we don't know what to treat first, you see? And knowing self-diagnosis helps us to get more focused on that. All right, now I'm going to move to the second part here. I'll just give you a heads up that we are going to cover all of this in about another 20, 25 minutes. We might run a little bit over, but I'm going to cover all these main points, and I'm going to tell you about the course at the end. So the second main point I want to touch on is the risks and benefits of internet medicine, and how do we actually use the internet in a way that is helpful for us. How do we separate what's going on? The internet is a huge resource, okay? But let's look at the two main categories of information. All right, there's a lot of resources available. There's practitioners that you can talk to for telemedicine, and there's online education about herbal courses, and there's scientific databases, and there's companies that produce herbs, and then you can get all kinds of books at no charge, download for free. There's archives and archives of old medical texts, and there's all kinds of different forums where everybody's sharing their ideas and everyone's getting confused by it. There's so many things that we can do with the internet, but I sum it all up into basically 2 levels and 1 important process. The 2 levels are, number 1, research and education. And the second is products and marketing. And the most important process that we have to learn is critical thinking, all right? And so self-diagnosis and personalizing botanical medicine involves learning critical thinking skills. And I think it's safe to say that right now, that in our culture, that the internet in general and critical thinking skills don't go together because so much of what's found on the internet is obviously not very healthy, destroying democracy, all these things. I won't go on to a political discussion about it, but I just want to say in the field of medicine, it's very simple. We can find things that are relatively neutral, all right? And neutral means research and education. And then there are things that are less neutral, and that means marketing. And so that's really the most basic thing that we have to apply critical thinking towards. Is this neutral or is it marketing? And once we figure that out, then we can protect ourselves from a lot of stuff. And that includes all kinds of products we don't need, and all kinds of dangerous claims about all sorts of cures, supposed cures, possible cures, and so on. So we look for neutrality, net neutrality when it comes to medicine, all right? And we develop critical thinking. So one of the things that we want to develop critical thinking for is so we avoid these trendy and wastebasket diagnoses. Now, a lot of these are found in natural medicine, all right? And it's sad, and it's not necessarily always totally incorrect. Like, for example, I mentioned a few things like SIBO and the heavy metals, and there's a lot of overemphasis on detoxification and parasites. A lot of times these are just wastebasket diagnoses. Practitioners don't know what's going on, and they say, well, you must have some kind of parasite or something like that. And it's not true unless you can prove it, all right? So here's another example, leaky gut. Well, that's very trendy. And the thing is that it's also correct a lot of times. But how long has leaky gut been around? As long as humans have had digestive problems, okay? There's been an aspect of leaky gut in digestive problems, and it's called different things in Chinese and Ayurvedic medicine, you see? So it's been around a long time. It's treated in a lot of different ways in classical Asian medicine. But suddenly now everybody has it, and there's all of the health gurus talking about it, and there's now all these products devoted to it. But the main question is that really the main thing to treat? It doesn't mean that it's incorrect. You can have it, but is treating it going to be your main goal? Or is it going to heal itself if you are taking care of other things? Or do you need to treat that along with other things together to get good results? You see, that's personalizing medicine and making sure that you're not just focused on something that's trendy. Now, allopathic medicine has its trends also, and its wastebasket diagnoses, and I'll just mention the #1 wastebasket diagnosis in modern medicine. It's all in your head, okay? That means they don't know what it is. So it must be depression. It must be anxiety. But, you know, trends come and go in allopathic medicine also. Lots of drugs come on the market and they're around for a while and they're discovered to be toxic and then they're taken off. All right. So we have to develop critical thinking and we have to really break it down. And when we come across something that's telling us, you have this, you have to first ask, well, is it even plausible that I have this? And this is where there's a lot of really far out stuff that's happening now on the internet, that all kinds of things are being attributed, all sorts of health conditions are being attributed to things that are just really not that plausible. Really, when you use critical thinking and medical training, then you know that there's just a lot of things that are not really what's going on, okay? So we have to identify dangerous marketing claims, especially. And you know, if you have been following my work, you probably know that one of the most dangerous marketing claims that I'm always talking about is people are being told to take essential oils undiluted internally, and that is damaging people's digestive systems. That is giving them liver toxicity and permanent esophageal damage. And that's something we must learn to think critically about. Ask questions. Is that really true? Is it really safe to take essential oils internally? But there's a lot of other things that we have to question. Okay, what are those detoxification methods? Are they really beneficial? You know, does doing that gallbladder flush really put all of those gallstones in the toilet? Well, the answer is no. All right. So we have to really take this apart and look at it more carefully just to protect ourselves, if nothing else. So the principles here: question everything, cross-reference everything, use established, reliable sources, separate the marketing from the medical science, and stay informed about the quality control issues with botanical medicine. All right, I'm going to skip now to the next part. I hope that you are finding this helpful, because these principles can guide us in really putting together an herbal program and protecting ourselves from what's out there and really getting the best of both modern medicine and and herbal medicine. So now I'm going to touch very briefly on the next point here, which is understanding the changing paradigms of medicine, botanical medicine and allopathic medicine. Because if we understand how they're kind of coming together, then we can start to use the best of each system. And when we use the best of each system, we get the best results. And I'll be very honest here, and I will say that I know that allopathic modern medicine is improving in a lot of ways very rapidly, that there were treatments that were done even 10 years ago that were extremely invasive, very toxic, barbaric, actually. And now they are being replaced with things that are far better, far less toxic, far less invasive. And in many cases, we may find that these more innovative, more humane kinds of treatments are actually acceptable for us. And they might be the best treatment, especially if we have been doing natural medicine for a period of time and not getting the results that we want. So I always advocate for allopathic doctors to be open-minded about natural approaches. And I also advocate that natural practitioners and patients be open-minded about allopathic medicine, because it's not a clear case of good or bad. It's just using the right thing at the right time to get the best results. That's what we want. So how is the paradigm changing? Okay, so there's allopathic innovations, but there's also a lot of new emerging health conditions that make it very challenging for allopathic medicine to deal with. I mean, the pandemic of COVID is a perfect example. You see, there's 4 aspects of COVID, 4 stages of COVID. There's boosting the immune system. This is best done by natural medicine, herbal medicine specifically. Allopathic medicine can't do that very well, okay, without critical potential side effects, all right? Then there is the treatment of influenza, and herbal medicine has always treated influenza, and it can be used effectively. And I am seeing that herbal medicine for the influenza and many of the symptoms is very effective. But then there's a third stage, which is the emergency critical stage. And that's where you leave the herbal medicine and the natural treatments, and you don't worry about whether elderberry is giving you a cytokine storm or not. You go to the hospital, okay? And then there's a fourth stage, which is a recovery. And it is emerging now that there are a lot of people with post-viral fatigue. And allopathic medicine has nothing for that either. So herbal medicine really is the best treatment for 3 of the 4 stages of COVID, you see. So that's an example of new conditions that are coming out. But we also are recognizing the limitations of allopathic medicine more and more. People want to get off their medications a lot because of the side effects. It's as simple as that. And people are recognizing that herbal medicine really does do a lot of good things. So one of the most fundamental things, however, that I want to touch on here is that what's really changing is the paradigm of the doctor-patient relationship, all right? So the old paradigm is the doctor knows and the patient follows the instructions, right? But now there's a whole new class of people that are coming out of necessity, who are really looking for answers. They're educated, they're empowered, they're questioning, they're more health conscious. And therefore, along with the access that we now have through the internet to all this education and resources and databases and products and all these kinds of things, you have a new class of people that are highly educated patients, highly educated and empowered patients. And they don't want to be doctors or practitioners, and they don't want to be patients either, you see. So it's a third class of people, as it were. It's a new paradigm, and it's more like the doctor-patient partnership, all right? And in a really good partnership, the doctor is going to be really open-minded and will learn from the patient, and the patient will learn from the doctor. So that is something that is coming out of necessity. And this is also what I mean by being a self-care clinician or practicing clinical level self-care, is that in a lot of cases, people know more than their doctors do about what they have. So what are we going to talk about next year? I think that, okay, here's a good question that comes up a lot. And I'll just mention that both this presentation and the course that I'm going to tell you about in a couple of minutes, they're based on almost 40 years of clinical practice. And in the last period of time, the last couple of years, I've been doing a lot of telemedicine with people, education through my courses, and a lot of consultations. And the questions are oftentimes very, very similar. There's categories of questions. And so one of the basic questions that comes up a lot is, I don't want to start this medication. My doctor wants me to start it. I don't want to do it. Or closely related, I want to get off this medication. Or another closely related question is, I have to start chemo, but the doctor doesn't want me to do natural treatment along with it. You see, so these are the issues of the changing paradigm of medicine. That's because now it is very common for natural medicine to come in contact with allopathic medicine in the doctor's office, all right? So if you don't want to take the medication, what do? You don't want to start it, you want to get off of it, you want to use something natural in conjunction with some other kind of allopathic treatment, what do you do? Well, I'll give you a couple examples here just to outline my thinking, all right? One of the main things that I want to share with people as we go through this in the course is I would like to basically illustrate for people how I use critical thinking and detective work and thought processes to solve certain kinds of problems, you see. And that's what we're facing. It's not a question of, oh, you just take this product. We're trying to solve fairly complicated medical problems now. And the reason that I'm talking about all this is because we have to solve it ourselves, you see. We have to be educated, empowered patients and doctors as well. So here's a couple of examples. of this interface between herbal medicine and allopathic medicine. And they're kind of at two ends of the spectrum. So let's say you have GERD, okay, gastric esophageal reflux disorder. All right. Now, if you have a lot of room to improve your diet, that's a factor. And if you know that herbal medicine is good for your upper GI, you know that herbal medicine is a primary, highly effective treatment for upper GI conditions. And you also have done the research and you know that proton pump inhibitors that they're going to give you for your GERD have serious short and long-term effects. And you also know that GERD is uncomfortable, but it's not life-threatening, okay? Then if you put all these things together, you would probably decide to try herbal medicine first for a period of time and personalize it and use it really well, use it effectively, all right, as a primary treatment. But now on the other hand, let's look at a different kind of example here. So you have been trying natural medicine for several years for your hypothyroid, okay? And it's just not moving the needle, and you are educated, empowered patient, and you're highly disciplined, you're doing the diet, you're doing the exercise, you've got a good herbalist you're working with, you're getting acupuncture, you're doing everything, and you've been doing it for an extended period of time, and it is just not raising your thyroid levels, all right? Well, in that situation, you can't consider it a failure, because it could be that if you were not doing all of those things, your thyroid would be getting worse, you see. But in a situation like that, as you're getting older, you may decide, well, all right, maybe I should just do a small dose of Nature-Throid, okay, or some basic thyroid medication. And keep in mind that people who use natural medicine and are health conscious, they get better results with allopathic medicine also, you see, because there's herb-drug interactions that can be very positive. So if you are a healthier, stronger person, you won't need the same dosage and frequency of the allopathic drugs, all right? So that's something to think about. So now, two more points that I'm going to give you here very quickly. And this has to do with how do you apply clinical level self-care and personalize your home pharmacy, all right? And a very big part of this is just learning what the herbs do and understanding how your body works. So how do we personalize botanical medicine when it comes to an herb program? Well, we apply all the things that I just told you about. We learn clinical level self-care diagnosis. We learn critical thinking with the internet, and we learn about interfacing with allopathic medicine. Those are the 3 points we've covered so far. And so then, once we have a diagnosis, an understanding of what we're treating and what our objectives are, okay, either through allopathic or natural diagnostic methods or both, then we start using the herbs in a sequential, organized way. And there are specific practices of how to do this, okay? We start with learning the preparations, and those are basic principles. We start by learning to pay attention to the body and understanding that most of the time, we are not paying very close attention to the body. Most of the time, we are only getting the body signals when they are really strong. But the body is always giving us very subtle levels of information, and we can learn how to pay attention to subtle levels of information sequentially. And this is a link to another aspect that I talked about earlier, which is self-diagnosis and self-awareness. And self-knowledge is spiritual. It has to be spiritual because it's based on enhancing our intimate connection with nature through the body. So first we learn how to use basic applications of herbs, but we also have to know what are the high quality sources. And that's simple. I'll just give that to you. So there are places where you can get really good products. So it's not complicated, really. We just need to know certain kinds of things like if you take an herb before a meal, it's different than if you take it after a meal. So there's a biorhythm, and we just study the principles. You understand the principle, you know a lot more about herbal medicine. And you don't have to break it down a lot of times into great detail, because the broader principles guide us in how to take care of ourselves. So some things are hard to digest. We should just know that. And some things are contraindicated. We should know basic contraindicated herbs. If you have gallstones, don't take turmeric, things like that. So what it really comes down to, the concluding point here, is that no matter how good an herbalist is, how good an acupuncturist is, how good an allopathic doctor is, no matter how good the practitioner is, everything is an experiment, all right? So what we can do by personalizing herbal medicine is that we can be more educated before we start our experiment. And the more educated we are, the better the experiment will go. And the more aware we are of our body, the better the experiment will go. And if we have a high level of training, knowledge, research, and self-awareness and sensitivity, we're going to get really good results from our experiment. And one of the things that I'll just share with you personally is that I have learned through this whole process is that sometimes, we're confronted with health challenges. I've had more than my share studying medicine in Asia. Studying Ayurveda in Kathmandu made me an expert in respiratory infections and parasites, also real parasites. So one of the things that I have learned that has helped me to deal emotionally with having an illness is just looking at it as an experiment. Okay, so now I have this inflammation in my gut and we do have a positive finding of parasites. What do I do? Okay, well, I want to know how to learn how to take care of this. And now that I have learned how to take care of these things, I'm an expert in doing it because I've treated myself, you see? So that's a way that we can think about ourselves. It gives us a little bit of a spiritual perspective, all right? That it's really something that, okay, here's the body, it's doing things that are out of balance. Let's approach it like a science experiment. Let's see if we can get this thing to work right, okay? So it's a way of creating a little mental detachment from what's going on. Okay, so we need to learn how to adjust our herbal program. And this is a very important point here. And that is, you don't want to go back to a practitioner, even if you have the resources. You don't want to keep going back over and over and over again, checking in, oh, now they're adjusting this and they're adjusting that, when you can do it yourself, okay? And there's a lot of reasons why you don't want this to go on for a long period of time. And that's because we should always have botanical medicine. First, we have an acute problem, but then it's going to change. It'll become chronic. But then it's going to be completed. The healing will be done. And then we will want to shift from treatment to prevention, you see. And as we get older, we want to personalize the medicine for the different phases of life. And if new symptoms arise, we want to know how to adjust it and treat it. And we also want to know what to do if the program stops working. And this can get to be really expensive and time consuming unless a home pharmacy is part of our lifestyle and we know how to use it. So that is now how I teach people, okay, to use herbal medicine. In the consultations, I tell people, all right, here is a home pharmacy and you are going to use this for an extended period of time. And it takes a little bit more time to educate people about how to make the tea and add the tinctures and use this during this time of day and all these kind of things. But then once people have that, and it's sitting there in their kitchen, it's on the shelf, once they know what the herbs do, what they feel like, when they should best be taken, then you don't have to talk to me again. You can do it yourself for years and years and years. So that's the basic idea. Now, we're out of time. I do want to tell you about the course. And I'll just tell you, I'm going to keep it really short and sweet, all right? But one last thing here. What are we going to do to personalize botanical medicine when there's complex challenges like restoring our health after antibiotic use and things like that? Well, a major point here is we must have realistic expectations, okay? And if we don't have realistic expectations, then several things can go wrong. First of all, people are disappointed. Oh, it didn't work. And they thought, well, it should be, I should take this product and it should take care of it in a week. But what if you need 6 months, you see? So That's one of the basic ideas, is that you must have realistic expectations, and that's linked to knowing what the herbs do. Because if you know what the herbs do, then you will have a realistic expectation of when and how they will do it, you see. So that's a fundamental principle. Second, we need to know how to measure progress. And I mentioned a good example of this, like with the thyroid. A lot of times we're not measuring progress like actual progress. And a lot of chronic problems, we're measuring progress by staying the same. Okay. If you have a condition and you can keep it the same for 10 years, a lot of times that's great. That's really good progress. All right. So we need to know all these different things about how do we measure going from point A to point B. All right. And third, we also have to understand the balance between detox and rejuvenation. Okay. Cleansing, purifying versus nutritional support, immune boosting. All right. And that's critical. That is a basic problem, misunderstanding that a lot of people have. Everything is just detox, detox, detox. It is not. It's based on your age and your constitution and your health condition and your weight and your digestive power, and all of these things will determine how much detox or rejuvenation you can do. All right. And that's always a factor in complex and chronic situations. All right. And then closely related to that is, when do we attack the microbes and when do we support the terrain immunity? All right. And this is fundamental in cases of real parasites, and that includes Lyme, okay, and its co-infections. And this is a huge epidemic now, and very complicated, and people are, everybody is confused about it, all right, including myself. But I fall back on basic principles, and that is that if you have Lyme and you are taking antibiotics daily for 5 years, something's wrong. Okay, you're not getting the results you should be getting. And furthermore, taking all kinds of bitter, strong antimicrobial herbs is not going to remedy that situation either. You see, maybe you should think about boosting herbs instead. All right. So I think it's about time to wrap things up. Now, how am I going to wrap things up? I'm going to do something that's a historical first, and that is, I'm going to tell you about my course. And I'm going to give you the URL for that, and it can also go in the chat. And that is, let me just give you the place where you can see this course, okay? It is clinicallevelselfcare.com. Pretty simple, clinicallevelselfcare.com. And now what I will do is I am just going to go through this page, and I'm just going to tell you about the course, because now I've introduced the main topics, all right? And I'll just point out that, first of all, it's a 5-week course, and it's live and it's online. And I'll just give you a little warning here. As you scroll down, you're going to see register now buttons, okay? Well, gives you plenty of opportunities to register. And I'll mention, make sure that you don't push that unless you really intend to, because there's so many registration buttons as you go down here, you might end up registering and not even mean to. So here we have the course here, okay? And we have an overview of the course, and then there's all of these bullet points about what you're going to learn how to do. And I gave you the overview of it. And another register button. And now we go into all of the modules here, okay? So the modules are actually fairly closely related to the way that I just broke down my presentation. So module 1, self-care diagnostic skills. I've introduced a bit about it, okay? And there's more that comes in that module. And then 2, risks and benefits of internet medicine. And you can see even more points that I'll be talking about. Module 3, the changing paradigm. I've introduced it, and now you can see all the details about it. Module 4, clinical level self-care in the home pharmacy. And in case you are wondering where I'm at here, it's at, the URL is in the chat. You can just click that directly, okay? So it's clinical level self-care, in case you're wondering what I'm talking about here. And then module 5, the last module, common complex challenges, okay? And then this is what you're going to get, and the format, the venue. You're going to have a live class every week, Thursdays at 5, okay? And It's going to be live streaming video. It'll be recorded. Okay. You can, you don't have to attend live. You can attend anytime during the course, afterwards, whenever. And now we have some bonuses, and you might find these interesting. So these bonuses are available if you register, and you saw all the register buttons. All right. And there's more. So if you register up until Thursday, this Thursday, October 15th at midnight, it goes away, and you're going to get these following things. So I have a presentation that I have given several times. It's a topic I'm very interested in. It's the impact on visionary plants on culture, and specifically how certain kinds of visionary plants, like the Soma plant of the ancient Vedic India, had a profound and lasting effect up until today, had a profound lasting effect on religion and spiritual practice. Okay, so I'm going to talk about Soma, the Soma cult of India, and I'm also going to talk about Kaikiyan, which is the elixir, the vision-inducing elixir that was used in the Greek mystery cult of the Eleusinian mystery cult. All right, so that's Soma, ancient elixirs, modern entheogens, and mystery cults. And that is a 90-minute event that you are invited to. It's one of the bonuses. And then here's something just as special, or even more special, for those of you who like to do meditation practice. And so really this whole package of offerings, it's the course, it's another lecture on a different topic. And then every Saturday, for 5 Saturdays, then we're going to have a guided meditation. And some of you are familiar with this practice, but there's going to be more of it. And it is the listening to the heart meditation. It's based on just listening to the heartbeat, listening to the pulsation of the heart. But there are many things that we can find in this. We can find the interface between mind and body. We can find the universal life force of prana that is pulsating the heart and bringing our awareness to the outside world. We can find the whole river of life when the pulse started, going all the way back to the first heartbeat. It's in there, all the way to the last heartbeat. And yes, that will happen. And we can learn to feel the whole river of life pulsating through the heart. So you are invited to that. That's one of the bonuses. And now it's just all the details here. You get live Q&A with the class. And we're also going to throw in a little bit of material from the Combining Herbs and Essential Oils course. And these are going to be the modules for treating the respiratory conditions. All right. And then there's even more. There's a 20% discount at the Floracopia store, and you're going to get the transcripts. So there it is. I just gave you my marketing pitch on the new course and all the bonuses. And there are all of these places. If you haven't encountered a registration button yet, just keep on going. There it is. Here's the price. Okay, enroll now, $149. And one last thing, that I will be doing consultations. And many of you have had consultations with me, and thank you very much for that. And if you are interested, there's a whole bundle that goes with that. So you get the course and you get a consultation at a discounted rate, and that's it. And there's a little description here about what the consultation's about. And oh, here's the price again, and all the different ways you can pay. And there's Deepak saying something nice about me, and other people who have said nice things about me. So, all right, that's it. And so with that, I'm going to wrap things up, and I'm just going to say thank you to everybody for attending this broadcast. And it looks like a good number of you joined us. And so thank you very much. And check out the URL, okay? One last time, clinicalselfcare.com if you're interested. And if you are, then I will see you there. Thank you again. Take care, stay safe.